I'm Cheryl Naslin. I'm here with my colleague Mary Miller from the Wasserman Center. And tonight we have an excellent panel that we are presenting to you called Career Paths in Public Health. So what we're going to do is we are going to start by introducing, well, I'm going to have each of the panelists introduce themselves, talk a little bit briefly, maybe 3-4 minutes, about their background, kind of how they got started in the field of public health. And then we're going to ask them each a few questions, and there will be plenty of time for you guys to ask our panelists specific questions that you may have for each of them. So, and I did want to start also by saying that all of our panelists tonight actually are NYU alums, so that's a really nice thing that our alums are coming back to talk to you. Okay, so we're going to start with on my immediate left with Ellen, and you can tell us a little bit about your background, and we'll go from there. Thank you.
Good evening. My name is Elena Kromeyer. I think I'm the dinosaur of the panel. I graduated in 2009, and my career has kind of led me to various different places. Professionally, I kind of started out in research, working for NYU at Langone, actually, on an obesity and diabetes project. From there, I went on to gender-based violence, and I worked in a domestic violence shelter in Brownsville, Brooklyn. It was a great experience, doing more direct services. And then from there, I moved on to more of a policy role. I became very interested in health policy, so I worked for the New York City Council. And the big draw there was not so much politics, as I learned, but running the Women's Caucus and working on the health committee for the councilwoman I worked for. I realized politics was not for me, so I moved back into more of a public health role, working for a maternal child health organization in Central Harlem. I was working on a Merck for Mothers grant, looking at maternal morbidity and mortality in Central Harlem. And then from there, I stayed at the same organization and directed a community health worker demonstration project, which was the flagship program of the New York City Department of Health's new Center for Health Equity. So I ran that program. It was also very interesting. Large program, working in public housing in East and Central Harlem. And then from there, I thought I was going to pursue a PhD in public health, so I moved to England. And I decided that my research focus was not aligned that well with my mentor. I wanted to look at kind of health disparities and maternal health outcomes, looking at different ethnicities. In the United Kingdom, particularly Latin American women, which happens to be the largest growing migrant population in the United Kingdom. They were more keen on looking at South Asia, Sub-Saharan Africa, and the West Indies, because that is where they get more of their immigration from compared to Latin America. So I came back to New York last year, and I've been working on a policy, systems, and environmental change initiative with the Trenton Health Team. So I commute to Trenton, New Jersey. I live in Jersey City, so it's a bit of a commute. And I also direct a mobile health clinic initiative that's funded by the Robert Wood Johnson Foundation. So that's kind of where I am now.
Hello, everyone. Can you hear me? Is this good? Okay. I'm Megan. I work at, we are now the Parkinson's Foundation, but we recently merged. We used to be the Parkinson's Disease Foundation, so it can get confusing at times, but I work in Parkinson's. I graduated in 2016. I had class with Charlie, and then I graduated with these two. So I started out in California. I did my undergrad in anthropology, and then moved out to Connecticut and did 3 years with Teach for America. Taught 5th grade, realized we have a huge health crisis on our hands when 10-year-olds don't eat breakfast or lunch unless it's provided by the school, and oftentimes don't go home with dinner. And so I applied to NYU and got in and did the nutrition track. And then went to the career fair at Wasserman and found an internship at the Parkinson's Disease Foundation. And I've been really happy there. I did an internship for almost a year and then took a break. And then when they realized that I was still in New York and not in Ghana like I had planned, they asked me to come back. And now I'm there full time. And what I do is I manage our patient portfolio. So we have over 300 volunteers who are people with Parkinson's or their care partners. And I make sure that they have all the resources they need to work with researchers on research projects. And then we also have a Women in Parkinson's initiative that addresses, we just got a $250,000 grant from Corey. And so what we'll be doing is we'll be hosting these regional forums to create a research agenda that's driven for women with PD. Because quoting one of our advocates, women are not just small men. They actually respond to medications very differently. They have very different social situations. And so when they're diagnosed with Parkinson's, it can be very different than when a man is diagnosed. And so we have that initiative. And then what I also do, sorry to keep throwing things at you, I also, when I was hired full-time, asked if I could handle the evaluation component of our patient portfolio because it had never been evaluated. And so now I spend about half of my time going through, started in 2008, so years and years of data to figure out how to evaluate essentially a qualitative program.
Hi everyone, my name is Charlie. I graduated from the MPH program in 2015. While I was a student here, I was a biostatistics teaching assistant, and I also worked at the NYU LGBTQ Student Center as a graduate assistant, and I worked at Perry Halkitis' center, the Center for Health, Identity, Behavior, and Professional Studies, as their outreach coordinator. So while I was a student, I worked a ton trying to figure out what I wanted to do. And then I graduated and took on a job at the New York State Department of Health at the AIDS Institute, and I've been there for about 2 years now. I was just promoted last month into the LGBT Health and Human Services unit, so I now work as a contract manager. So basically, I help to write contracts, then we release them, we review them, and then I manage them. So they're LGBT health related, which is my passion, so I'm really happy that I got promoted. I used to work in the Office of Grants and Data Management, and that was not super exciting. So I wear a few different hats. I also have been involved with the Hudson Pride Foundation of Upstate New York, and I was in the board of directors, and I was recently voted as the executive director, so I go to Hudson a ton, so I'm upstate every other weekend. And I also work for a seasonal CSA, so if anyone's interested in food systems, I work for a local CSA in the summer, winter, and fall. We have sites across Brooklyn, Queens, and Manhattan, and I manage 2 of their sites. It's a full diet CSA, and we work with farmers and local producers to give people local produce and products weekly at sites near their home. That's it.
Hello, I'm Sylvia. I graduated from the MPH program in 2016. Public health, I guess, was a bit of a career change for me to come to get my master's. My undergraduate was in biology, and I was a microbiologist for 5 years working in tuberculosis. And as much as I loved it, I knew I wanted to do something that involved more human interaction. So I started volunteering a lot to try to figure out what I wanted to do with my life, and I had always been very interested in reproductive health. And one of the places I volunteered at was Planned Parenthood. This was back in Texas, where I'm from. And I realized I really loved it, so I decided to come to grad school here. While I was doing the Community International Health track, I interned at the City Health Department in their Sexual Reproductive Health Unit. I also interned at International Planned Parenthood Federation, Latin America or Western Hemisphere region, and then I worked at the Guttmacher Institute, which is a data research think tank for reproductive health. And now I work at the City Health Department. I'm the special assistant to the Assistant Commissioner the Bureau of Maternal, Infant, and Reproductive Health, which is a very, very long title. And basically, I am like a Swiss Army knife assistant, project manager, speechwriter extraordinaire. I don't know. I've been there about a year. And we, our bureau works in reproductive health, and then with programs for pregnant women, and then for infants.
Hi everyone,
Can you hear me?
my name is Julianne and I graduated from the MPH program in 2016 also. I was in the Global Health Leadership track, and I'd say that my journey in public health really started when I was studying social work. I did my bachelor's here at NYU in social work and then decided to do a master's. When I was doing my MSW, I was completing my field placement at an NGO at the UN that was doing social policy and health policy research. And constantly throughout the research that we were doing, we were seeing that health was kind of at the intersection of a lot of international development issues. So from there, I really decided that I wanted to kind of pursue a career in global health. So that's when I began the public health program here. And a few months into the program, I began an internship with MSF Doctors Without Borders, specifically for their women's health program. It was in their communications department, and it was supposed to be a campaign that really brought attention to some of the women's health issues that MSF is constantly encountering in their field projects. So that campaign, it included a published book, a panelist series, and a couple of different webcasts really highlighting these issues. From there, I ended up staying on with MSF in the communications department on another campaign that they were doing that focused on like displaced populations, and particularly the health implications that displaced people, which includes migrants, refugees, asylum seekers, are currently facing around the world. And I've been working on that project for over a year now, and I'm now the Special Events Video Associate there in the Communications Department. And that really consists of this traveling exhibit. It's called Force from Home, and some of you might have seen it. It was in New York, and hi. And yeah, it basically was this exhibit that was a 1-hour guided tour, and we had MSF field workers who were working in some of these contexts around the world. So whether that was Syria, whether that was Honduras, whether that was South Sudan, it really ranged in the locations of displacement. And we had these aid workers bring groups through different stations that reflected different aspects of displacement. So whether that's medical needs, whether that's basic needs or legal status, a whole range of issues. So that's where I'm at now. Sorry that was really long. But
Great, thank you. Okay, so what we're going to do now is I would like for each of you to talk to the audience about what some of the most rewarding aspects of your work have been, and perhaps a little bit what some of the challenges have been. And then you can start.
It's funny, I was talking about this very question last night with my boyfriend, he's a physician, and I said, you know, sometimes in public health it's hard to see impact while you're working on a project. And it's hard to kind of think long term that, okay, what I'm doing now might not have any sort of effect or change in the population, especially when you're dealing with population level health, right? Whereas like a clinician, sometimes dealing with individuals, they see real impact immediately sometimes, right? So I guess what I find really rewarding is just seeing the community that I've worked with, or whatever community it's been, when they become engaged in their own health. because believe it or not, sometimes that is one of the most challenging things that you encounter working in public health, especially when you're dealing with poverty, issues of social justice, inequality. Health sometimes falls at the bottom of the hierarchy of need for people, and this was a real challenge on the community health worker project I worked on in East and Central Harlem, looking at asthma, hypertension, and diabetes. A lot of the things we would hear were, well, I don't have a job, and I need a job, or it's unsafe living in public housing. So I've survived this long having asthma and diabetes, for example, so why should I care about that? So that's a real challenge. So when you do find, a population or a group of people who are engaged and really want to change their health outcomes, that's probably one of the most rewarding things, as well as policy changes. I'm currently working, one of my areas is Tobacco 21. I don't know if you guys have heard of this. It's kind of a big national campaign that's gaining momentum to raise a legal age to purchase tobacco products at 21. Only 2 states have done it, California and Hawaii, and there are a number, New York City passed it. There are 21 cities in New Jersey today who have passed it. Trenton will be the 22nd. We actually have our first city council hearing tomorrow with a vote. So when you see those policy changes, kind of pass and get implemented, that's also very, very rewarding. I guess a challenge, there's so many challenges. I kind of talked about some challenges within the successes, but I guess when you come out of grad school, you have an idea sometimes of what you want to do. Like, I thought, okay, I want to work in women's health. But you sometimes take a very, very long detour, and you find yourself doing, jobs that maybe you wouldn't have aspired to when you're in grad school. Nonetheless, you do learn a lot in most jobs if you want. So I think the job market is a very challenging thing that people with a public health degree face. Not just public health, I think a lot of professions. Unfortunately, I graduated 2009, height of the recession. So a lot of my peers didn't find jobs at all with an MPH. So I felt very lucky that I found a job. And it wouldn't have been my top choice working in research, but it was a good job nonetheless, working with NYU. So that's a real challenge, is finding stable work, first of all. Second of all, in the field or area that you're most interested in, right? So when you're working with grants, they have a life. So, anywhere from 1 to 3 years. And then you basically eat what you kill, is how I see it in public health. So you become a bit of everything, like a grant writer and a researcher and a policy person. And, I love that about public health, but just be prepared for that, I would say, and be flexible. Stay flexible, because I think the job market will dictate that.
Okay, so I'm gonna cheat and say challenges and rewards are pretty one and the same. But I have 3, so I take notes because that's what I do. My favorite thing is I get to work directly with people. I work with people with Parkinson's and researchers, and then I get to work with community leaders. I really liked that part of teaching. I didn't love the bureaucracy of teaching when I was part of Teach for America, but I loved having people I talk to every day. And I still get that working with the Parkinson's community. So there are people I know their personal lives, I know their families, I know when they go on vacation, and I have their vacation pictures on my desktop, and so I really love that aspect of it. But on the other end of that, because we're a community-based organization and because the community influences all of our decisions, it can be really challenging to work with someone with Parkinson's who has cognitive decline. Because as a millennial, I can be a smart ass sometimes, and I'm sorry I said ass. But I think I know everything, and I walk in, and I'm like, no, I taught for 3 years, I know how to design a program, I know how to teach, I don't have to listen to you. And that is really, close-minded, and it's limiting, but you can kind of excuse it, oh, they have Parkinson's, this is a cognitive issue, but it's really not. Sometimes they really do have insight. And so I've really had to teach myself how to just, without being defensive and without having the answer and without closing everything off, say, okay, that's a possibility. Let's see if we can make it work, and let's see what the barriers might be. So I work with a great community, but they can also be really challenging, given the nature of the disease. And then the last thing that I like, but is also just sometimes just drives you crazy, is, especially now I'm bringing it up, everything's constantly changing, funding's changing, everything's changing, whether or not the NIH will be there, whether or not the vacancies in the FDA will fill. I have my grant for the next 2 years, so that's something. But it's day to day, it's going to change. And so you have to really, like, I sometimes want to pull my hair out because I'm like, how many times do I have to change this memo, or how many times do I have to rewrite this grant? But at the same time, it's also taught me a lot, and so it's really rewarding because when I talk to, I recently got to go to, they just merged too, and I'm going to mess up their name, but the Lupus Alliance. And they want to develop a patient advocacy program. And so I got to go talk to their executive director of their science department and say, this is what we do and this is how we model it, and here is putting a thing for program planning. Here's the logic model that we use for our programs. And they were able to take that, and it was really collaborative, and we got to share. But like, go with the flow with the ever-shifting environment, because it never will slow down, unfortunately. But it's always good to plan to be one step ahead of the game.
Yeah, I definitely want to echo what Megan just said. The environment is surely changing, as you know, and I work at the state government, and we receive a lot of federal funding, and a lot of our integrated planning, this is a challenge. A lot of our integrated planning was surrounding the National HIV/AIDS policy and strategy that was out, and the Office of National AIDS policy is now like not existing, and NHS is also not being necessarily staffed or pushed out in the ways it was before. So we had, and I'll say, like, we had a president who was pushing HIV and AIDS and was doing things to properly address the epidemic. So in the state level, we were able to get more funding. We're also able to get more guidance. And that's also inspiration, and it's value to our work as a state government. And we have our own initiative, the Ending the Epidemic Initiative, which has federal dollars attached to it, has state dollars attached to it, and all of that without proper planning is sometimes missed if you're not a step ahead. And that's challenging for me. I'm a contract manager, so I manage grants for organizations that rely on funding from the state. So we're a funding entity and a source. The state government is mostly filled with contract managers. But things that we had a few months ago are already being challenged, and matches, federal dollar matchings that we had a few months ago are also not coming through in the same ways, and that's going to continue to happen. And we really followed ONAP and the NHIS, and that was part of our planning. So now in a state level, we are progressive and we have our own plan, but we also look for the government and the national state for guidance. So that's a huge challenge, but it's part of the game, and it's public health, although it should not be a controversial political issue. It depends on what you're into, and then it becomes a controversial political issue. And of course, I'm involved in LGBT health and HIV and AIDS, which are both, on the chopping block, I would say. So that's difficult, and also working with a nonprofit in upstate New York and rural New York, we struggle with funding from people and where people want to put their dollars now, where they feel more comfortable, where is it more necessary. So there's shifts, but now there's so many different attacks. I don't want to bring this up, this feels so depressing, but there's so many attacks on communities that people don't know where their money's gonna have the most impact. So you're seeing ACL, you get a lot of money, but the smaller nonprofits in the city and across the state may not be getting similar attention, but really need the money. So there's a lot of struggles with funding, no matter what. Even in state and city health departments, like, we rely on federal funding, and we rely on federal leadership, most importantly. So there's a ton of struggles surrounding grants and money, but also the benefit is you're the ones who are leading this effort to continue to make these issues a priority. And the people who you're impacting are the ones who will be thanking you for their life, because you're the ones who are potentially saving their life by devoting the time and taking like not so great jobs at the start of it, and being flexible and having to be the grant writer and the reviewer and the manager and everything in between, because no one else is going to do it. So you devoted your life to public health, and that comes with a lot of weight, but the power in helping communities and giving them what they need is what you'll get out of it, and that should be the most rewarding aspect, and that really should be the thing that gets you up in the morning, not money. It's not going to be a paycheck that makes you want to get up in the morning. It will in time, I say. In the government, I have a decent salary, I would say, so there are spaces in which you can feel secure and comfortable. I don't know if it's likely or unlikely. I don't, maybe somewhere in between that thinking, but there is a sense of security if you can get it. And I think the beginning few years after your undergraduate degree or your MPH, there's a feeling of you're at the bottom of a nonprofit totem pole, and that's just the reality. And you have to make yourself valuable and worth it to stay. And then when someone retires, you'll take that vacant position, you'll move up, and then you'll stay. But it's that difficult period after you graduate where you need to make yourself as valuable as possible. And my recommendation is really to start working now. So get involved, volunteer, work part-time, do what you can, meet your capacity, like have your undergraduate or graduate breakdown now, like get there, get to the point where you're gonna have a breakdown for being so involved with everything, and then you'll know your capacity moving after you graduate, and you'll find yourself, but you'll also know what you're interested in, so you don't have to navigate the world of, having a job that you really don't like, because there are opportunities, and the best way of getting those opportunities is to work as a volunteer or an intern now in the organization, show your strengths, and then you can get in. So there's successes and there's tons of challenges as well. Sorry, that was depressing.
Well, I guess I'll try to cheer everyone up. So a lot of the work that we do is around abortion and contraceptive access. So of course I feel like I'm in this constant state of outrage and like stress right now. But at the same time, I feel like we are in a very progressive city and a very progressive state, and our mayor and our governor have said that they're going to stand and help ensure that women and all individuals have access to the services that they need. And I feel like, even though I feel, and my colleagues at the health department also feel like scared and unsure what's going to happen, uncertain, we also feel very energized, and I personally feel very energized that we have to keep fighting and partner with marginalized communities and just like put a strong united front. So that's my pitch for Let's Fight. I guess what do I find very rewarding about my work, specifically at the health department? I think it's the lens that we're taking under the leadership of our commissioner to really address the issue of health equity and make sure that all New Yorkers have that where you live in New York doesn't dictate your health, which is definitely an issue. It's just really great to be part of an organization that's leading that work, and especially in the bureau where I work, where in maternal health we have such crazy disparities in New York City, like where a Black woman is 12 times more likely to die from a pregnancy-related death than a white woman, and that I feel like that I'm even in a little bit part of helping close those gaps, and is really rewarding for me. But then, I guess a barrier part is that working for a government agency involves bureaucracy, and bureaucracy can be very frustrating. It helps you develop patience, so I guess I'm an optimist, so that's the silver lining. And sometimes there's also a lot of political stuff that is like behind the scenes that comes into play. Like we can't make decisions because there are like political things going on, which is frustrating too. But at the same time, I feel lucky that I'm kind of get to see this behind the scenes stuff about how decisions get made. So.
I kind of echo the former speakers in saying that one really challenging aspect recently has been working in this kind of like geopolitical thunderstorm that's going on, especially being part of an organization that's supposed to be impartial and be independent, but at the same time advocate for our beneficiaries. And basically, I'm trying to navigate that really fine line, especially being part of a communications effort, has been really tricky. I'd say that one of the greatest rewards I've had in my particular role has been being able to bear witness to some of the people who have gone through tremendous traumas and tremendous situations, being forced to flee from their homes, even if that is secondhand. One of the big parts of my role has been to coordinate production of 5 360 virtual reality documentaries that profile families from Iraq, Lebanon, South Sudan, Honduras, and some families that are traveling through Greece. And one of my favorite parts of that whole process is after we get all of the material translated and we are able to go back and read what has been said, and just kind of matching the words with the people and their reactions, and really putting a comprehensive story together has been really powerful for me. And being able to communicate those stories and share them with people around the world has been probably the most important aspect of what I've been able to do. But one really great challenge that's gone along with that is being faced with having to learn new technology that I had no idea how to do. Like I said, I'm working in video, so I have a lot of knowledge of the issues because, I mean, they're what we study in public health. But knowing like physically how to communicate those in a really effective way has been a total learning process. And yeah, one recommendation I'd also say is just being really agile and kind of being comfortable with the whole learning process and accepting picking up new skills and whatnot.
Thank you. So before we open up to Q&A, one last question that I wanted to ask all of you guys. If you could each very briefly let the audience know something that you wish you knew when you were a student that you know now. And then we will open up 2 questions.
Okay, I'll be very brief. I guess the job market for public health, I can't stress that enough. And what my colleague to the left has said, which is intern as much as you can while you're in grad school. I did it, I think I had at least 2 internships per semester, because that's how you're gonna make your contacts. And yeah, and networking. The kind of importance of networking, even throughout your professional career, once you're out of graduate school, but you should start day one networking, going to talks, going to events, not just related to public health, but and kind of other programs that have talks that you might be interested in. Because I realize, a lot of this hidden job market, it really does occur. Like it's who you know, who you talk to. And another thing is just, I'm a pretty opinionated person and very vocal about it, is don't burn your bridges. Because I think I did that quite a bit, especially early on in my career, and it's a very small world, public health. Like you're just always crossing paths with people, constantly. You wouldn't think so in New York, but you're constantly crossing paths. Even now that I'm in Trenton, I'm still always working with or meeting people who know a lot of people I work with in New York. And then when you get into smaller fields like maternal child health, it's even smaller. So, just bear that in mind in your careers and in school. But yeah, definitely get out there and network and intern, try to find a job, because I think that's probably going to be the most helpful way for you to get a job.
So I have 2, and I'll be fast, but I'm also going to be somewhat controversial. I do think that you should intern, figure out what you want to do. But one of the best pieces of advice that was given to me at some thing I found through some panel in sales, believe it or not, was nobody's going to notice if you're working hard all the time. If you work smart, that's when people start to notice. So depending on who you are and what you want to do, like if you want to be at the office 12 hours a day and never take vacation and do, like that's fine if that's what you're happy, but make sure that you're smart about it because burnout can be a very real thing. And I know you're like super thrilled and pumped now, but like if you're doing something 12 hours a day and you're not getting acknowledged or you're not being, constantly rewarded, make sure that you're okay with that decision and just be sure that you're working smart as opposed to just working hard. The other thing I want to say is have an ask or come with an offer to wherever you work. I was able to help expand some of our programming just because I wanted to do it. And I brought it to my boss and I said, hey, we don't do this. I would like to, can we? And she didn't say no. She let us do it. And so we were able to collaborate with some big pharma companies and actually hold these focus groups. And I was able to do the write-up and we were able to write abstracts and now they're at these conferences. And so like, it's just because I asked. So if you have something that you're interested in doing and that you're in an organization that you trust that you notice doesn't have that available, ask about it. And if they say no immediately, ask if there's another way. Because I'm sure there's no such thing as like a no in employment. There's always a find a way to do it for free or cheap, and then maybe yes. So just go with an ask or an offer.
So as a grad student, I didn't have as much of an opportunity as I wanted to with getting involved with the actual campus. But oddly enough, I figured out how to do it really quick, and I worked at the LGBTQ Center. But through that, I learned about CMEP and the Health Promotion Center, and there are trainings and there are events on campus that you can go to for free all the time that are incredible. So yes, leave the campus too, because like my colleagues have said, in each of your little niche interest areas, so mine's HIV and AIDS and LGBTQ health, when you go out to those events and you go to a few more, and you go to a few more, you see the same exact people at all of them, they start to notice you. Once they start to notice you and you're like a young, jittery person with energetic energy, and then they want to hire you or get to know you or involve you, and the spaces are so small and you need to know those people to move forward, but also it's just good to build and to learn and to hear from older folks about how the movements have continued and sustained and what you can learn from them, but also what they can learn from you. So there's such power in those small communities, but also on campus. I was so grateful to work at the center, but I did a ton of programming with CMEP, and we did faith programming and we did health promotion programming, and I learned a ton on campus. So keep an eye out and go to some of the events here, but also leave the campus as much as possible. You're in New York City, so CUNY they really have like fun talks not saying NYU doesn't, but CUNY also has great free talks, like City College and also the New School, places like that. They have really cool social justice talks that I always go to. But it's good to be well-rounded, and because in this time and age, public health and social justice are linked pretty closely. So it's good to know as much as you can.
I'm gonna jump on the bandwagon of interning and volunteering as much as you can to help you really find what it is that you love, because I think there's nothing more rewarding than doing a job that you really, really like. I feel like 100 times happier working in public health than I did working in a lab, because I really, really love reproductive health, and I love that I get to do that every day. And then my other advice would be, or something I wish I would have done more, is get to know my classmates more, because I got to know the people that I had classes with, but I wish I would have expanded my net a little more, just because public health is a very, very small world, and you're gonna see them again, and yeah.
I'm gonna sound like a broken record, but it's really true. I would also really recommend trying to get an internship that you really enjoy and you see yourself maybe working with that organization post-graduation. I started as an intern in my job. My supervisor started as an intern at our organization. And our department manager started as an intern also, like many years ago. So I think it's a really great way to segue into an organization and really kind of show them your skills. I would also echo the notion of really trying to diversify your professional profile and building up skills that directly relate to a role you might see yourself in one day. You can graduate and have a plethora of different degrees, but if you don't have practical skills, applying for a job becomes really difficult. So.
Thank you. So before we open up for questions, just really quickly, is there anybody here that did not sign the sign sheet? Okay, so we're going to just pass that around one more time. If you didn't get to sign it, if you could do that. Also, you'll notice we just handed out some evaluations, so when we're totally finished, if you could fill those out and hand them, you can, actually that's a good point, just leave them on your seat when we're done. Okay, so who has questions? Yes, in the blue with the bar. Yeah.
Okay. Do you want me to stand up?
You can just, yeah.
Okay.
That's fine.
Hi, I'm Kashfia. I'm a second year. I'm in the Community International Health track, and my question can be to anyone or all of you. So, what were the factors that made you decide to either leave your job or stay at your current job or previous jobs? Like, what was it? Was it the environment, coworkers?
I'd say it varied for me in each job. And like I said earlier, once I was in a job, I realized that I became interested in a certain component of that job. So I pursued sometimes, like when I was working gender-based violence, I said, well, I actually like policy, so that's when I pursued that. A lot of it is also the work environment wasn't always right. Like I thought maybe I could go somewhere where I could grow more. Or the mentality was maybe a little bit different. Also grants, like some of my projects just ended. Like I knew that they had a finite time, so I had to find something else. So it's really a variety of reasons, yeah.
Okay. I think for me, I work in the government, and you can see once you get into an org or the government or wherever you work, whether or not there are going to be promotions coming soon. Like you can basically see it. And in my space, there are not a lot of young people hired in the state government. I don't know what the case is in the city, in the Department of Health, but I can see everyone's about to retire. So if I stay in 10 years, I can be the director of something. So I can just stick around and do great work, and you're gonna be able to see the spots for promotion. Not every space is like that though, but a change in environment is something that you may need, and that might be a reason to move as well, but career prospects are important.
Thank you. So in the interest of time, we're gonna, for each question, we're just gonna have one or two panelists respond, if that's okay. Who else has a question? Yes, right here in the front.
So I'm a first year student, and my question is, does the concentration matter in the sense of, should you recommend taking a certificate to have a broader understanding of public health?
Does your concentration matter? No. I was nutrition, and I am now Parkinson's disease. I love nutrition, but I don't touch it at all. And then our organization actually, it's like a feeder system from Wasserman. We keep hiring NYU public health students.
That's what we like to hear.
We just hired one from the career fair that was in November. And so she's actually, well, she was undergrad, so I don't even know what major she was. But as long as you're qualified at what you do, I don't think that your concentration really matters. As long as you're passionate about it and you're qualified, people, like the network thing people are talking about, if they know you and they know your skill, it doesn't really matter.
I think I agree. I think when we were in the program, there were less options too for concentrations. You guys have a plethora of options now. I think unless you're really, really into epi or like just want to be a biostatistician, then I don't think it matters. I think that that's what the electives are for, and take as many electives as you can in the areas that interest you and help you become very well-rounded. I think that would help.
Who else has a question? Yes, go ahead.
What would you guys say are the most important skills to learn while you're a student in this program?
For me, I think one of the most important classes that I go back to a lot was program planning, but just because that's the area I work in, but like learning how to do a logic model is really helpful. Like you should know that, I think.
I think just a general skill, learning how to communicate information in some capacity. I've found in many different public health roles, no matter what you're doing, in some way you're going to be asked to communicate something to someone. And I mean, that's a really good practical skill to try to develop. I'm still trying to work on it, so.
What else? Yes, in the back right there.
Hi, I'm Elijah. I'm a first year. So I had a question about grant writing. You all were talking about that. And I wanted to know how you kind of developed those skills in terms of like grant writing. Is it difficult?
So I didn't have any skills in grant writing, but I recommend that you all do because all the orgs that come for funding need to know how to write grants, and we look very closely at how a grant is written and how you can match the requirements of the RFA. So if you can, that's a huge skill to go into a nonprofit with, is being able to write a grant. Because state and federal government people don't necessarily know the populations as well, or the services as well as, are you doing the checklist? Does your grant reflect the RFA's components? So it's very much of a bureaucratic, like, you got a point here, you got a point there, you got a point there. That's how I review them. That's how I'm told to review them. But I know people and capacity and how the org can do it, but not everyone thinks that way. So in a state and federal government's eyes, you need to be just learning how to write each component of a grant. And that is basically how an organization sustains itself. Without it, they don't. So that's super important. If there's a class, take one. If it's out of the scope of your degree, they might offer a 0 credit grant writing class or 2 that you can take that I would recommend finding.
Yeah, I mean, just to echo that, like if you look at jobs sometimes, like what's available, it's like grant writing is kind of like the sales of a private company. Like they're almost always hiring a grant writer or someone that can do like donor relations, things like that. The other thing I would add is take budgeting classes, or like, you know, I had one of my professors, I think it was program planning, she offered budgeting like outside of class that her husband taught, so it wasn't part of her class. And anytime you get to a director level, you're gonna have to know how to run a budget and understand it really well, and it behooves you to know exactly how your money is being spent. So budgeting is very important too.
What else? Anyone else have a question? Yes, in purple.
Did you always find yourself in an activist role, and do you see that being increased with the current administration?
I don't think I've considered myself an activist until now. I just feel like I've been passionate about what I do and what I would like to do, but I feel like now it's like my job to be an activist just because of the crazy situation we find ourselves in.
And when I moved to the city, I joined ACT UP, which is the AIDS Coalition to Unleash Power, at the center. So I was very much of an activist, and I was an activist for trans folks and for people living with HIV. That is super important to have been an activist before basically needing to be an activist. So there is a lot going on, and I think a lot of orgs, especially surrounding like reproductive justice and HIV and LGBTQ people of color, basically everyone, undocumented, anyone, there is a sense of activism that you need to bring. So that's a skill on its own. Knowing how to protest, I don't know. That's important because orgs appreciate your ability to, within certain capacities, to advocate for the rights of the populations in which you are serving. So I think that's hugely important way to get involved too, and to indirectly network with other organizers and people, because usually they have jobs in the field and they're activists on the side.
Any other questions? No other questions? Oh, yes, all the way to the back, yes.
Where were the best places to look for internship and or job?
Say that one more time.
Where were the best places or sites?
To look, search engines, you mean? So
Or
that's, that's
career
resources
center
to look for internships.
So I highly recommend Wasserman, especially when it comes to your resume and like how to write a cover letter and how to write a thank you letter, because as someone who does hire people now, it's really nice to have that piece and that professionalism on it. I also found 2 jobs through Wasserman and have hired people through Wasserman, so I strongly recommend Wasserman, but also your professors, not necessarily for jobs, but for networking. So your professors aren't going to, just because you're a student, they're not going to directly say, oh, let's hire you, or I have a job for you. They may have free work for you, but I would be willing to bet that they know someone who knows someone that's hired. And several of my friends from the program actually weren't hired by their professor, but they were hired by a friend of a friend. And that's how they found their job. So do reach out to your professor and see if you can network, or if they know anyone who's interested in anything like that. And have like an informal, if you can schedule an informal conversation, an informal interview, just say, hey, what do you do? I would really recommend that too, just to get to know what their position is.
We did that.
Oh, no, go ahead.
We tried to do that a lot, and we felt like sometimes I think when academics are in their positions, as long as they are, they don't quite understand what the job market can be like sometimes. So we would literally, like, I remember like all my peers would just have to spell it out. Like, do you know if they're hiring here, you know? And like, so that wasn't that useful for us, I'd say. It was, even like, just look up the website of the organizations you like and send them emails or call. And sometimes, I mean, rarely is someone gonna say, no, you can't volunteer here. Even if it's not a structured internship. I did that a lot. I did that with Madre, Latino Commission on AIDS. Like, just like write them, call them and say, hey, I'm in grad school and I'd love to give some of my time. And I rarely found anyone that said no.
Okay, last question, yes.
My question is just following up on the internships. For bigger foundations, like say the Bill and Melinda Gates Foundation, if we wanted to intern with them, what's the best way to reach them? Because email isn't, I've sent them a ton of emails, but they actually have an automated email that responds and says, we won't answer to your email, basically.
Do you use LinkedIn at all? Okay. So build up your LinkedIn, and that's how I've connected to a lot of organizations. Like in a case like that, for example, like see if you know someone there, and they can make an introduction that won't just end up in their spam or something.
Yeah, I agree. Find someone maybe lower ranking at like the Clinton Foundation or Bill and Melinda Gates, and that way go get coffee with them, because people like to talk about what they do for at least a few years into the profession, and they'll meet with you. But yeah, trying to email their general volunteer email lists are nearly impossible for those types of organizations. But there are people who maybe just started and somehow got a job. I tried to get a job at the Clinton Foundation, did not. It was impossible for me. But people who do have jobs and are successful, lower ranking would have a cup of coffee with you and tell you maybe how they got there. There's probably some bureaucratic strategy involved. I would want some of those.
Well, I think that hopefully you guys can stick around for a little while if some students still have some additional questions. But I do want to thank all of you very much for coming. This has been